Okay. Okay. So the reason that I asked Polly to come and join us is because I really, really wanted this lady to give her views about chronic pain management. So, Polly, you have a subsidiary life going on, don't you, with Topcat? What is Topcat and why is it important?
Okay, Topcat Metrology Ltd, to give it its full title, is a tiny company that makes, designs, trains in the use of nociceptive threshold testing equipment to fit on any species that you care to try and ask us. Nociceptive threshold testing is a way of measuring an animal's response to a painful stimulus. Mm-hmm. It means that you have to give them something which hurts, and you assess you measure the point at which they respond by their behaviour.
Yeah.
So it is looking at the sensory side of pain. It doesn't look at the affective side part of pain. Pain has two bits. The sensory bit is what you feel, and the affective bit is how it makes you feel. Mm-hmm. And nociceptive threshold testing looks at the former almost exclusively. Mm-hmm. But in order to measure anything, to see the effect of a painkiller, to see if the pain has got worse, you need to have the objective information about sensation. So it's quite a big contributor to all studies and developments in pain and pain relief.
Okay, so I'm going to just put that into English. A few things that CAM followers might be a bit worried about. When you say that you have to hurt them, you're not actually talking about major harm. You're talking about quite minor degrees of discomfort. So it's a high temperature, or it's quite a poke, or a pressure, isn't it?
It's exactly that, yes. And the most important thing about it is that it's transient, i.e. it goes on, and as soon as the animal indicates that it hurts, the stimulus is stopped, either by them or with something that you're applying by hand. You stop it.
Yeah.
And it doesn't cause any damage.
Yeah, and that's the point. It doesn't cause any damage, guys. But the reason that
it's exactly what will happen if somebody is asking you where something on you hurts and they poke you. That is a nociceptive threshold test.
Right.
But doing it with things that you can measure means that you can compare two different painkillers, you can compare the right side of the body and the left side of the body, and you can come back tomorrow or next week and know whether it's got worse or better. Exactly. Because you've got numbers.
And this is what I wanted to talk about, because something that is very neglected in the management of chronic pain, and osteoarthritis is a chief culprit for causing chronic pain, is being objective and being able to quantify whether the intervention that we've chosen is actually working. Because when we're looking after our dog or our cat or a horse, our emotions and our beliefs have a huge effect on actual truth. So it's very commonplace in first opinion practice for the vet to say, so how is he? Is he better? And the owner will say, yeah, I think he's a lot better. Now, how much of that is actually truth, or how much of that is subjective opinion, and the human involved in that subjectivity is very variable in themselves, depending on what mood they're in, their previous experiences, how their previous dog behaved, whether they had an argument with their husband in the car just before they walked in. It's a very, as I say, subjective opinion rather than an objective. Now, why is this important? In the vet context, we have many areas that we are able to be very objective, such as with blood results, urine results, heart rates, pulse, temperature. These are all very objective ways of working out whether our intervention is working or whether the disease process, illness, is improving itself. But chronic pain is so difficult, isn't it, Polly?
Yes, I mean, even acute pain, this applies. It's hugely dependent upon how it's being interpreted. And even in people, when they are able to verbally report, there's a variation. But when you get to an animal, you are interpreting their behaviour in order to come up with how you think they're feeling. So you've got a double effect here, because it's how you interpret what they're doing, and you may miss subtle behaviour, or you may wrongly interpret something that's more obvious. So it's an even bigger problem.
It is a big problem. And when we're dealing with these chronic diseases, in my opinion, it's something that really needs to be tackled, because if you're managing a dog's pain for years, there's a potential for a significant outlay on something that isn't working. There's a potential for suffering when a believed intervention is being employed, but it's actually doing nothing for the animal, but you believe it is, so caregiver placebo. So it's kind of quite funny when you look at it like we are doing, that we haven't got more focus on being objective in managing chronic pain. Does that make sense, or am I confusing you? It seems a disease that's so needed to be objective. There's such a requirement, but unfortunately we still haven't got that being wheeled out in first opinion practice, have we?
No, we definitely haven't. I mean, I think part of the reason for that is that it's quite difficult to do. And the various techniques like weight bearing, when you start measuring it, it's all quite complicated, and it's not something you can do regularly on a daily basis. So I think this is part of the reason. And it's also very difficult putting numbers on something that is effectively subjective. I mean, even to the animal, it's subjective.
And variable.
And depends how they're feeling, and, you know, whether they enjoyed their breakfast or not, whether there's a thunderstorm, all this sort of thing. So it isn't altogether surprising, because it's difficult. I mean, that doesn't mean it isn't still needed, but and I'm not making excuses, but it is much more difficult. And even using something that's objective, like the weight bearing and gait analysis, so forth, or the sort of things that I've been involved with, where you're actually poking them, for instance. It is only looking at sort of part of it.
Yeah.
I mean, it's quite important, and it's very useful having something that is so objective that you get numbers that you can see go up and down. But it is only part of the problem.
Yeah. So that's why in many clinical trials, multiple methods are used within one trial. So it's not uncommon in a drug trial that a owner-facing questionnaire, validated owner-facing questionnaire, will be used alongside force plate analysis, clinical examination. It's about using a combination. Now, the reason that this is really important to me, getting more and more deep into the world of arthritis and all the potential interventions, is that there's a lot of things out there that suggest that they could help, could work, but they haven't got very good evidence behind them. And I wanted to do this, I wanted to chat about this so that owners that were interested would have a better understanding of what sort of things are being done in the background of, say, drug trials. So they have a greater understanding, and dare I even say, maybe a greater respect to the lengths that are taken to try and get evidence that that intervention actually truly has a high hope of working in the majority of cases. Is that fair to say?
Oh, it's absolutely fair to say that the veterinary literature is littered with reports of treatment X for problem Y, and 90% got better, but we've no idea whether they might have got better anyway, because there was no comparison with no treatment. We also don't know whether whatever it is was actually more harmful. We're saying we're asking an owner to treat their dog with whatever it is, and we don't know whether it makes them better, and we don't actually know whether it's making them worse, because we don't have any controls.
Yeah. So just for owners to understand what we're saying now, and I've only really learnt this in recent years, and I've got a lot more to learn. I know I did get taught this at university, but I do think that it fell out my ear hole after I qualified.
A long time ago, after all.
I know. But when you're looking at evidence of something working, there's more to it than it just having a reference. So if you're looking at something online and you see a list of references, first of all, you've got to check that they're actually even about the product. Then you've got to check whether they're actually about the combination that's within that product. Then you've got to check whether it's actually even about the species that it's being marketed to. Then you've got to check about the study size, whether there is more than 4 dogs in it. Then you've got to check what kind of structure that the study had, and whether it really truly is looking at what they say they think they're looking at. And it's so complicated, and so many things are very well marketed, and they put a load of little letters, 4 or 5 references, 1, 2, 3, 4, 5 at the bottom, and people go, oh, well, that must mean it works. And I guess I wanted to get you on to talk about the complexity that we go to try and prove whether something really does work. So can you just talk about a few of your Topcat bespoke devices and how they work? And CAM followers might listen to this and go, what is the point? Other CAM followers and pet professionals might go, well, I didn't know that. And that's actually really interesting, because I've never really thought like that. So explain about some of the tools that you market, sell, and you do so because you believe in them, because you've used them for years.
What I'm going to do is start with a little bit of history to explain how Topcat got to where it is now, because I think that will help to explain what they do. A long time ago, I had a colleague working with me who was looking at the effects of opiates, so the morphine relatives, in cats, with a view to using them for pain relief. Cats had a bit of a reputation for not responding terribly well to morphine, but we know now that they respond like everybody else if you give the right dose. So you could look at how the drug behaves in the body. You could take blood samples and see whether the cat's excreting it or what have you. But we needed to have an objective test to see whether the morphine was actually acting as a painkiller. And there wasn't anything available commercially that produced that acute, short-acting, painful stimulus at a measurable degree of the stimulus, so that you could find out how they respond, at what temperature, for instance, they respond when they're untreated, and then you give them the drug and you see the temperature at which they say, ouch, it goes up. So you know that you've had some effect in terms of pain relief.
Mm-hmm.
Now, so that was the very beginning, and the other half of Topcat Metrology is Mike Dixon, who is an engineer. He's not a vet, he's an engineer. He likes making things to measure things that are small and difficult, and he made the first thermal stimulus, which was used on cats. And it's a little tiny probe that sits against the skin on the thorax, and you remotely now, by infrared, like the thing that you work your television with, you make it heat, and at the point that it hurts, and we're pretty certain it's the point that it hurts because it's the same as the point that it hurts us, the cat will react and they'll turn to it, they'll bite at it, some of them will jump in the air, and you immediately turn it off. So it's a transient stimulus, but you get a measurable temperature at which they respond. And then you give them morphine or whatever it is, and the temperature at which they respond goes up, or actually it usually goes to the point where we make it automatically cut off so we don't cause any damage.
Yeah.
You can do exactly the same thing with a pressure stimulus. So we have a thing called a prod, which is it's a mechanical finger, if you like. It presses into the animal, and at the point that it hurts, they respond, and that is the so-called threshold. It's the force at which that particular probe makes them hurt. And this was originally used for developing drugs and drug dosing protocols for painkillers in cats. That was where it all began. And in fact, the thermal stimulus, which is now developed, has been quite widely used for drug registration for analgesics, particularly for cats, both in Europe and in the USA. And to a lesser extent, it's also been used in dogs, horses.
That's amazing. That's amazing. You should be so proud of yourself. Yes, some of it is really quite exciting. In fact, buprenorphine, vetogesic, in cats, I still believe has probably done more for welfare of cats having surgery than any other drug, and that really got its license, at least in part because of the Topcat Metrology. Amazing. Check you out. That is incredible. Like, so Cam follows buprenorphine. Polly just showed her age by calling it Temgesic. I haven't heard it called Temgesic for about 10 years. It's an opioid, so it's a very strong pain relief that we use. We use it a lot in surgical situations, acute trauma, pancreatitis, nasty cystitis, things like this. We use it a lot, and it has a reasonably good length of action. So we know that it's in the system and it's working for, say, about 6 to 8 hours in a cat, or is it a bit shorter in a cat?
Some cats, it's at least that long. I mean, it's certainly a lot longer than pretty much all of the other opiates.
Yeah, and so
some of them it's still working tomorrow morning.
So it's an amazing medication to be able to use. And well done, Polly, on you. I didn't know that. So for me, when we had our curry recently and we were talking about algometry, I'm actually quite proud of where I work, because I feel that we put a lot of emphasis on being objective, and we use an algometer over the lumbosacral junction for lumbosacral disease. Now, could you explain what that is so people understand?
Yes, algometer means algo is pain and meter is measure. So it's basically something that measures pain. It's usually used to describe something that produces mechanical pain, i.e. poking. And it has some system in it that it measures either the force or the pressure. As it's usually you push it against the animal and you increase the force yourself. There may be some ways of controlling the rate that's on the machine and so on, but basically you are pushing this mechanical finger, some sort of flat-ended pin that goes into the animal, and at the point that they respond, the force at which you're pushing at that point is recorded as the threshold. So you can see that if the animal has got worse this week, that threshold will go down, i.e. they will respond at a lower stimulus.
Yeah.
And if they've got better, it will go up because they are tolerating a greater stimulus.
And what kind of things do people use it on? Because we use it for lumbosacral, so we will use it at the lumbosacral junction with a dorsal downward slow pressure, waiting for the dog to dip away to show that first sign of that's not nice, I don't like that. And yes, it's not 100%, it's not foolproof, but it's certainly, in my mind, a step towards being more objective about whether an intervention is improving that animal's tolerance, that animal's comfort. Do you see it used a lot?
It is not a huge amount of use, but it's definitely growing. It's come originally from research studies, and to me that's how clinical ways of doing things should happen. That somebody has a question and you look at it under research conditions, so the conditions are controlled. You have a hypothesis and you see if that is proved or not. And then if it seems to be working, you then put it into the clinic. And I think a real example of that is the use of an algometer. The work that Duncan Lascelles did in Bristol a long time ago, where he looked at the use of an algometer. I won't tell you what it got called, but it was a thing that you poked into the animal, and it was entirely done under research conditions. So it was done under Home Office license under the Animal Scientific Procedures Act. But these were real animals undergoing neutering, and they used the stimulus around the wound and also somewhere else on the body to see the effects of when you gave an analgesic compared with no analgesic or analgesic only afterwards and so forth.
Right.
And that system is now accepted as a clinical tool that helps to guide you whether your treatment is actually doing something or whether you're just imagining it.
Yeah. Now that's a phrase there, okay? Whether it's actually doing something or whether you're just imagining it. Anybody that's listened to any of the CAM talks, any of the owner workshops, you will hear us talk about caregiver placebo a lot. And we do it for your own safety, for your animal's safety, for your wallet safety, because it's something that really isn't talked about enough. And it's very, very common. So there was a paper, I think it was by Consenius, and he, I actually heard him present this at EaseFot in London, and they were talking about a drug trial, and the owners with dogs that were on the placebo, not the actual medication, I think it was around about 57% of owners saw improvement in their dog, even though on force plate analysis there was no change. I know that's slightly flawed because we're not looking at the effective change, emotional change. But what was really scary in his work was the vets who were also blinded to what animals were on medication and what ones were on placebo. 40 to 45% of vets also felt there was improvement in the dogs on placebo when there was no objective change, because they were heavily influenced by what the owners felt. So those figures are actually really quite scary. And one of the things that I hope CAM tries to help the CAM followers do is just keep your wits about you. I don't want to say the word skeptic and cynical because they're quite negative. We want you to keep your wits about you, that a lot of things don't come with promise. And you do need to check that it is actually improving your dog's quality of life and pain state, not that you think it is. And that's why I really wanted Polly to come and talk to us. And we will do this again properly with her lovely face next to mine. And I want us to kind of just... It is lovely. I just really... I personally, this is my opinion, I feel that if the public understood the lengths that we go to try and make sure that our interventions actually work, maybe it would restore some faith, because I think there's a lot of fear within the public about vet choices of interventions. And I know from my extra studies, my extra courses, my greater understanding, I've learned to respect the interventions that we hold dear to us a lot more, because I now understand the procedures that are done to try and check whether these things really work or not. Is that fair?
I think that is fair. I think there's still an awful lot of room for improvement, because there are an awful lot of reports published in peer-reviewed journals where there is no distinction between placebo effect and otherwise, because there isn't a placebo. And I think I would add two things here. To a certain extent, a placebo effect, if it really is making somebody feel better, a placebo effect is fine. Which is why I think one of the reasons that alternative medicine is very often good, because you're treating the whole animal, the whole person, and you're making them feel generally better about themselves, because they're not just sort of treated as a body part, they're a whole person. But that's in a person. In an animal, we're still interpreting what they're doing, so we still don't actually know whether they really are feeling better, or we just think they are. I mean, as we've already said. So in a way, the placebo effect is less useful in animals unless we actually really know what they're thinking, which some people might claim to, but I don't think I do.
No. And I think...
Does that make sense?
Yeah, I think it makes so much sense. And I think what complicates things even more is that there isn't anything out there, as you say, that can look at the physiological, the like somatosensory, the physical presence of pain, as well as the emotional presence of pain. And a lot of the studies where they saw no improvement in, say, force plate, they don't actually account for the fact that the dog actually could have just felt better. I know.
Yes, yeah, it's true. And I think this is probably where the quality of life questionnaires that have been very well validated really do help, in that they are getting as much as possible away from owner interpretation, but they're sort of objective, subjective, if you see what I mean.
Yeah.
But I think it's probably most important that both sides of the coin are looked at the same time to get an overall opinion.
Yeah, totally agree. So, because this is obviously not panned out how we'd like, so thank you for everybody that has stayed with us for a slightly weird Hannah in a fish tank video clip, and Polly on a phone. The take-home message for the big week, you're the finale of the big week, is that we all need to keep our wits about us. We need to not fall prey to heavy marketing. We need to be as objective as we can do. It's very easy to get influenced by other people's opinions and allow it to affect our judgment in our own pet. So what I hope people will go away from this with is the importance of being objective, trying to look at it in a multi-dimensional way, be it using some of these owner questionnaires, which I'm more than happy to give you guys links to go and look at, but also trying to consider how we can be more objective with the physiological side of things. And any vets or vet nurses that listen to this, you know, we will put the link to Polly's website, Topcat. What did you call it? Topcat
Metrology Ltd, or it's topcatmetrology.co.uk.
Perfect. I'm going to put it under here, because I think it's something that together the public and the vet profession, hand in hand, could start improving the way that we objectively manage these cases. And I think for me, again, in my opinion, it will raise the profile of arthritis from being just arthritis to being actually treated like a disease, which it is. So, thank you, Polly. Sorry for the...
Well, I'm sorry, it's about my broadband in the sticks.
You can go and drink your wine now, though.
Thank you. I've been very, very restrained here.
Well done. I'm proud of you. I'm proud of you. Well, is it the NHS clap for the carers again tonight? Or was it only last night?
Past. I thought it was only last night, but I don't know, and I don't think anybody can hear us out here.
Oh, okay. Well, I won't hear you clapping then.
Yeah.
But thank you guys for tuning in. We've got another big week next week. Over the weekend, I'm going to be recording some clips with a vet stroke behaviourist. So that's going to be really interesting. We have got David Dykus coming back next week. We also have Duncan Lascelles. He had to postpone. Yeah, he had to postpone because he had to close his lab because of the coronavirus. So sadness. But thank you very much, guys. I'm going to say goodnight, and I'm going to carry on chatting with Polly. Thank you very much for tuning in, and we will try to make sure that IT works for us next time. See you later. Okay.